Question 1. Which symptom is most commonly associated with Parkinson's disease? A. Hypertension. B. Bradykinesia. C. Polyuria. D. Hyperreflexia. Answer: B. Bradykinesia. Question 2. A nurse is caring for a patient with Parkinson's disease who has a risk for aspiration. What is the priority nursing intervention? A. Provide thickened liquids. B. Encourage high-protein diet. C. Place patient in a supine position. D. Limit fluid intake. Answer: A. Provide thickened liquids. Question 3. Which medication is primarily used to manage motor symptoms in Parkinson's disease? A. Atorvastatin. B. Levodopa-carbidopa. C. Metformin. D. Warfarin. Answer: B. Levodopa-carbidopa. Question 4. A nurse is assigning tasks on a neurological unit. Which task can be delegated to a nursing assistant for a patient with Parkinson's disease? A. Assessing muscle rigidity. B. Assisting with feeding. C. Administering medications. D. Developing care plan. Answer: B. Assisting with feeding. Question 5. A nurse is evaluating a patient with Parkinson's disease for medication effectiveness. Which finding indicates a positive response? A. Increased tremors. B. Improved mobility. C. Worsened bradykinesia. D. Onset of orthostatic hypotension. Answer: B. Improved mobility. Question 6. What is the priority concern for a nurse caring for a patient in late-stage Parkinson's disease? A. Urinary frequency. B. Risk for falls. C. Elevated blood pressure. D. Increased appetite. Answer: B. Risk for falls. Question 7. A newly diagnosed patient with Parkinson's disease expresses fear about losing independence. What is the most appropriate nursing response? A. You should expect to become fully dependent soon. B. It is important to focus on one day at a time. C. You must stop all activities that involve movement. D. You should avoid all physical therapy. Answer: B. It is important to focus on one day at a time. Question 8. Which physical therapy goal is most important for a patient with Parkinson's disease? A. Weight loss. B. Improved flexibility. C. Reduced cholesterol. D. Increased urine output. Answer: B. Improved flexibility. Question 9. Which finding should the nurse prioritize when assessing a patient with Parkinson's disease? A. Slight muscle weakness. B. Sudden confusion. C. Slow speech. D. Mild tremor. Answer: B. Sudden confusion. Question 10. A nurse should question an order for which medication in a patient with Parkinson's disease? A. Benztropine. B. Levodopa. C. Metoclopramide. D. Pramipexole. Answer: C. Metoclopramide. Question 11. A patient with Parkinson's disease is admitted with pneumonia. Which intervention should the nurse implement first? A. Encourage coughing and deep breathing. B. Administer antipyretics. C. Initiate chest physiotherapy. D. Provide humidified oxygen. Answer: A. Encourage coughing and deep breathing. Question 12. A patient with Parkinson's disease asks about dietary recommendations. The nurse advises avoiding which food during levodopa therapy? A. Low-fat yogurt. B. Whole grain bread. C. Aged cheese. D. Fresh fruit. Answer: C. Aged cheese. Question 13. When teaching about medication timing, the nurse should instruct the patient to take levodopa-carbidopa at what time? A. At bedtime only. B. 1 hour before or after meals. C. Only when symptoms occur. D. With high-protein meals. Answer: B. 1 hour before or after meals. Question 14. Which nursing diagnosis is a priority for a patient with Parkinson's disease experiencing difficulty swallowing? A. Risk for infection. B. Impaired physical mobility. C. Risk for aspiration. D. Disturbed body image. Answer. C. Risk for aspiration. Question 15. A nurse observes a patient with Parkinson's disease exhibiting shuffling gait. What is the nurse's best action? A. Encourage the patient to walk faster. B. Provide a walker to assist mobility. C. Instruct the patient to rest in bed. D. Offer a wheelchair for all mobility. Answer. B. Provide a walker to assist mobility. Question 16. A patient with Parkinson's disease is on a bowel regimen. What intervention is most effective? A. Encourage high-fiber diet. B. Restrict fluid intake. C. Administer sedatives. D. Limit activity level. Answer. A. Encourage high-fiber diet. Question 17. Which finding would require immediate action by the nurse in a patient receiving dopaminergic therapy? A. Headache. B. Dizziness when standing. C. Mild nausea. D. Dark-colored urine. Answer. B. Dizziness when standing. Question 18. When assigning care, which patient is most appropriate for an LPN under RN supervision? A. Newly diagnosed Parkinson's patient requiring medication teaching. B. Patient with Parkinson's experiencing respiratory distress. C. Stable Parkinson's patient needing routine medication administration. D. Postoperative Parkinson's patient requiring initial assessment. Answer. C. Stable Parkinson's patient needing routine medication administration. Question 19. Which symptom requires the nurse to notify the healthcare provider for a patient with Parkinson's disease? A. Resting tremor. B. Bradykinesia. C. Inability to swallow. D. Muscle rigidity. Answer. C. Inability to swallow. Question 20. The nurse is educating a family about home safety for a patient with Parkinson's disease. Which recommendation is most important? A. Increase use of scatter rugs. B. Install grab bars in the bathroom. C. Encourage the patient to climb stairs frequently. D. Place furniture close together. Answer. B. Install grab bars in the bathroom. Question 21. A nurse is caring for a patient with Parkinson's disease who reports frequent drooling. What is the nurse's priority intervention? A. Encourage fluid restriction. B. Position patient upright. C. Apply warm compresses. D. Offer a high-protein snack. Answer. B. Position patient upright. Question 22. Which type of healthcare professional is best suited to provide speech therapy to a patient with Parkinson's disease? A. Occupational therapist. B. Physical therapist. C. Speech-language pathologist. D. Respiratory therapist. Answer. C. Speech-language pathologist. Question 23. What instruction should the nurse provide to a Parkinson's patient to help reduce the risk of falls? A. Keep knees locked while walking. B. Take large steps intentionally. C. Avoid walking aids. D. Look down at the feet while walking. Answer. B. Take large steps intentionally. Question 24. A nurse is supervising a nursing assistant. Which action by the assistant requires immediate correction? A. Feeding the patient slowly. B. Assisting the patient with dressing. C. Ambulating the patient without a gait belt. D. Encouraging fluid intake. Answer. C. Ambulating the patient without a gait belt. Question 25. The nurse is educating a patient newly diagnosed with Parkinson's disease. Which statement by the patient requires further teaching? A. I will take my medication at the same time every day. B. I should eat a high-protein diet with every meal. C. I may experience dry mouth from my medication. D. I should continue my physical therapy. Answer: B. I should eat a high-protein diet with every meal. Question 26. A nurse is evaluating a patient's understanding of Parkinson's disease. Which statement indicates correct understanding? A. The disease is curable with medication. B. The symptoms will gradually worsen over time. C. I will stop taking my medication when I feel better. D. The disease only affects older women. Answer: B. The symptoms will gradually worsen over time. Question 27. When planning care for a patient with Parkinson's disease, which goal is most appropriate? A. Increase muscle tone. B. Prevent contractures. C. Promote weight gain. D. Increase blood pressure. Answer: B. Prevent contractures. Question 28. A nurse is teaching the family of a Parkinson's patient about safety modifications at home. Which items should be removed? A. Overhead lighting. B. Handrails on stairs. C. Area rugs. D. Night lights. Answer: C. Area rugs. Question 29. The nurse is caring for a Parkinson's patient who becomes emotionally labile. What is the best nursing action? A. Ignore emotional outbursts. B. Provide consistent emotional support. C. Limit social interactions. D. Restrict visiting hours. Answer: B. Provide consistent emotional support. Question 30. The nurse is preparing discharge teaching for a patient with Parkinson's disease. Which instruction is essential? A. Avoid exercise to prevent fatigue. B. Report difficulty swallowing immediately. C. Limit fluid intake to prevent drooling. D. Avoid use of adaptive devices. Answer: B. Report difficulty swallowing immediately. Question 31. A nurse is assessing a Parkinson's patient who is on a dopaminergic medication. Which side effect should be monitored? A. Constipation. B. Orthostatic hypotension. C. Tachycardia. D. Hyperkalemia. Answer: B. Orthostatic hypotension. Question 32. Which intervention should be included in the care plan to address fatigue in a patient with Parkinson's disease? A. Schedule frequent rest periods. B. Limit carbohydrate intake. C. Administer diuretics before activities. D. Increase daily caffeine intake. Answer: A. Schedule frequent rest periods. Question 33. The nurse observes a patient with Parkinson's disease having difficulty initiating movement. What is this symptom called? A. Dysphagia. B. Freezing. C. Dystonia. D. Myoclonus. Answer: B. Freezing. Question 34. When should a nurse schedule physical therapy sessions for a Parkinson's patient on levodopa A. Early morning before medication. B. 30 minutes after medication. C. Late evening. D. Immediately before meals. Answer: B. 30 minutes after medication. Question 35. A nurse is monitoring a Parkinson's patient for signs of dyskinesia. Which observation indicates this side effect? A. Increased saliva production. B. Involuntary muscle movements. C. Shuffling gait. D. Muscle rigidity. Answer: B. Involuntary muscle movements. Question 36. A nurse is caring for a Parkinson's patient with insomnia. Which nursing action is most appropriate? A. Offer caffeine before bedtime. B. Provide a warm bath in the evening. C. Encourage daytime napping. D. Keep the lights on at night. Answer: B. Provide a warm bath in the evening. Question 37. What is the nurse's best response to a patient with Parkinson's disease concerned about social isolation? A. Avoid public places to prevent embarrassment. B. Engage in community activities you enjoy. C. It is best to stay home to prevent fatigue. D. Focus only on physical therapy at this stage. Answer: B. Engage in community activities you enjoy. Question 38. A nurse is teaching a Parkinson's patient about preventing constipation. Which recommendation is most appropriate? A. Decrease fiber intake. B. Limit physical activity. C. Drink plenty of water daily. D. Use laxatives regularly. Answer: C. Drink plenty of water daily. Question 39. When assigning care for a Parkinson's patient with impaired mobility, which intervention should the nurse prioritize? A. Perform passive RUM exercises once daily. B. Encourage daily ambulation with assistance. C. Restrict activity to prevent fatigue. D. Schedule all activities for the evening. Answer: B. Encourage daily ambulation with assistance. Question 40. A Parkinson's patient is experiencing medication wearing off phenomenon. What is the nurse's priority action? A. Withhold the next medication dose. B. Notify the healthcare provider. C. Instruct the patient to stop all physical activity. D. Increase the dose independently. Answer: B. Notify the healthcare provider. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.